Hi, I'm Dr. Mitchell Chasin, Medical Director of Reflections here in New Jersey. In this video, we're going to be talking about facelift alternatives. If you like this video, please remember to give us a thumbs up and subscribe to our channel. And on the right side of the screen, you'll see valuable links to different resources in the field of cosmetic medicine. Thanks for joining us. So before we talk about what to do for the signs of aging, let's talk about what causes the signs of aging. Number one, genetics. From the moment we're born, we're predisposed to age in a specific type of way. If you're wondering how you're going to age, take a look at mom and dad. That pretty much writes the script. The key is to be proactive. Instead of waiting for things to be really bad and then to fix them, we'd rather be proactive and try to prevent them. Number two is deflation. Deflation means loss of bone, loss of fat from our faces. That's pretty predictable. Number three would be loss of some of the supporting structures, such as the ligaments in our face. They tend to get weak because of gravity. And what happens, some of the fat that starts out in the top part of our face redistributes to the bottom. The next thing is loss of elasticity of our skin. Sun exposure, smoking, loss of estrogen are all factors there. And the last thing, and an important thing, are just repetitive motions. We're smiling, we're frowning, we're expressive, which is wonderful. Over the long haul, however, it takes its toll on the skin. We start to see lines and wrinkles, and these muscles tug on different structures of our face. So the signs of aging in each person may be different. One person may experience jowling and heaviness in the lower face. Another person may experience more deflation or hollowing in the cheeks. And another person may experience lines, or what we call marionette lines. So not only what we see is different per person, but what bothers someone is highly individual. So the most important thing as competent aesthetic physicians is to talk to a patient and ask them, well, what bugs you? What do you see? Because it's not enough for us to evaluate someone clinically and to look at the signs of aging. We have to ask people, what bugs you? What do you want to treat? What do you want to tweak? So we've now talked about the causes of aging, and we've talked about what people see during that aging process. Now let's talk about the categories of treatment. There are 6 categories of non-surgical facelift treatments. The first is volume replacement. It's very common that we lose fat and bone in our skin, and we can use dermal fillers to replace that lost volume and restore natural-looking contours. The second is actually dissolving fat that forms in the lower face. Here we'll use Kybella, which is an agent that was originally brought out to dissolve fat in the chin. We're now using it to dissolve fat in the jowls. The third is skin rejuvenation, the use of technologies such as lasers to improve fine lines and wrinkles and to treat the spots we see from sun. The fourth are tightening technologies, ultrasound, radio frequency, therapy, thermage, Exless. There's a slew of different technologies, and they help tighten our skin. The next are using what we call neuromodulators, which are agents like Botox and Dysport and the new kid on the block, Jeuveau. And these things can slow down the repetitive motions that create creases in our skin. The next category of non-surgical facelift alternatives involves the use of what we call threads or fibers. And these are agents that can naturally lift portions of the face. And they're doing so in people that really don't need extra volume. Although sometimes a person needs some extra volume, where we'll use a dermal filler first, and then we'll gently lift the skin over that filler. So everybody ages differently. Someone may come in and their complaint is about their mid-face, that their cheeks look hollow. And the next person may say, well, I don't like my jawline. The key as aesthetic physicians is to look at the whole face, look at it as a whole, because we don't want to tweak one area and leave another area untouched. It starts to look artificial if someone does that. So we want to look at the face as a whole and create a plan. And that doesn't mean you have to do everything at once, but we do want an organized plan of attack, because facial aging is a journey, and it's really fun to participate in that journey and help people to feel better on the inside, because that's really what it's about. So we look forward to having you come to our office for complimentary consultation and come armed with what bugs you. We understand that it's not just about the things that bug you, but there are other factors that are involved in making decisions. Is there downtime? How aggressive is that treatment? Do I have ability for maintenance treatments? What's my budgetary constraint? These are all things we want to know to make sure we establish a plan of action that suits your needs and makes you happy.